Hi, this is Brian Kim. I want to share with you case number 13 in the best way to do cataract surgery series. This is a 3 to 4 plus dense lens with a medium pupil. And I'm going to show you the power of the mechanical fracturing technique using a double chop and cross chop maneuver and how I'm utilizing and leveraging mechanical fracturing to be able to do this case efficiently and safely. I use my corneal mark to help me center and size my rexus. I make my paracenteses incisions and inject intracameral lidocaine and epinephrine, disperse the viscoelastic. This patient has a strong Bell's reflex and it's looking upward, and so I'm using the Orlock technique to pull the eye downward so I can control the eye, and then make my triplanar corneal incision, make a vertical groove, and then funnel and then enter the anterior chamber. I'm still having to utilize the Orlock technique, pulling the eye downward. This patient has a left eye surgery. I'm using the cannula to hold the eye downward, which is toward the left. I do my puncture style capsule rexus, puncturing with the forceps and then pulling down and slightly to the right to create my flap. I grab and re-grab intermittently to make sure I follow the contour of the corneal markings to help me center and size my rexus. I do my capsular fornix hydrodissection technique, placing the cannula out to the equator, pointing it down and into the capsular fornix, getting a nice fluid wave, decompressing to the left and then the right, and then the lens begins to spin nicely. I lift my incision, and without irrigation, I enter the eye to minimize Descemet's trauma. I'm moving the surface epinuclear material. I place the chopper out to the equator, and then placing the phaco tip vertically, I crush the lens. You can see I have much more exposure of the phaco tip with this lens because it's a denser lens. I feel like the longer exposure of the phaco tip allows me to get deeper with the phaco tip, and I'm able to crush this lens completely in half. I place the chopper out to the contralateral equator and crush the right heminucleus completely in half as well. And now I have 3 free pieces. I grab one of the fragments and start doing my mechanical fracturing, crushing the lens pieces and using a little bit of vacuum and bursts of ultrasonic energy to emulsify the lens pieces. I like to crush the lens pieces to bite-sized pieces so that they're small enough to be able to emulsify fairly easy without using significant ultrasonic energy. You can see I'm just using the chopper and phaco tip to crush these lens pieces. I want to continue to minimize any trauma on the zonules, and I perform another cross-chop maneuver. I'm rotating the lens piece and then doing another cross-chop maneuver, crushing that lens piece, and then mobilizing that fragment. I'm using mechanical fracturing again to crush the pieces into bite-sized pieces, and then emulsifying the lens pieces. One by one, step by step, I'm grabbing and liberating each of these fragments, crushing them with the chopper and phaco tip, and then using the ultrasonic energy and vacuum to emulsify the lens piece, crushing the lens pieces, using ultrasonic energy and vacuum to remove the lens pieces. You can see half the lens is out. Again, this is a very big lens. I've decided to put some more intracameral viscoelastic to help coat the corneal endothelium. I'm placing the chopper again out to the equator and then placing the phaco tip deep within the capsular bag, crushing this heminucleus completely in half, making sure there's no bridging fibers, and then crushing this quadrant in half again using mechanical fracturing, crushing the lens pieces again, using mechanical fracturing to crush the lens pieces into smaller pieces, and then utilizing bursts of ultrasonic energy and vacuum to emulsify the lens pieces. This is the last quadrant, and whenever you're dealing with the last quadrant, you want to be very careful of the posterior capsule. I place and position the phaco tip and chopper around the lens piece to crush it, and then again using successive crushing maneuvers to again crush these into smaller bite-sized pieces, and then utilizing ultrasonic energy and vacuum to emulsify the lens pieces. You can still see there's still a pretty big quadrant still left. But again, when the posterior capsule exposed like this, you want to be very careful, very ginger. Again, I'm placing the chopper out to the equator and then crushing the lens piece with a chopper and phaco tip. Again, using successive mechanical fracturing forces, crushing the lens piece between the chopper and phaco tip, and then utilizing bursts of ultrasonic energy and vacuum, little by little, as sparingly as possible, keeping my chopper deep in the bag. And anytime I'm using the vacuum or ultrasonic energy, I'm making sure the chopper is deep to my phaco tip. This is the last piece here now, using the chopper and phaco tip and positioning those instruments around the lens piece, crushing it, and then with the chopper deep in the bag, emulsifying the lens pieces. You can see this is a very final small piece left. I'm crushing and then emulsifying, again, placing the chopper deep in the bag during the entire maneuver. and then removing the epinuclear material. I'm doing my fluid exchange, pushing BSS through a cannula, pulling the phaco tip out and exchanging it with the INA tip. I'm trying to keep the anterior chamber as stable as possible when I'm exchanging my instruments. I'm starting my cortical cleanup, starting subincisionally, removing the cortical material. I'm going around circumferentially. I like to grab and then try to pull in a slightly tangential motion to get wide pieces of cortex all in one piece. I'm using the polish mode now to polish underneath the anterior capsular surface, making sure there's no fine wisps of cortical material, removing any lens epithelial cells, and then also polishing the posterior capsular surface. I always like to push BSS and pulse it into the subincisional capsular fornix space because sometimes you can find some cortical material that's left behind. I'm pushing cohesive viscoelastic into the bag and then using my sweeper to sweep underneath the anterior capsular surface, first on the left side and then on the right side. I'm going to widen my corneal incision and then place my 3-piece acrylic intraocular lens into the capsular bag. I use a Maltzman to dial the trailing haptic in and then go in with the INA handpiece, go underneath the lens to make sure all the viscoelastics are removed between the posterior capsule and the lens, and then evacuate the remainder of the viscoelastic in the anterior chamber, and then hydrate my incisions. So this case, again, was a 3 to 4 plus, very dense brunescent lens, and I used mechanical fracturing forces, double chop and cross chop to crush the lens material. You saw I was able to choke up and extend the phaco tip so I can get a deeper placement of the phaco tip. And I was able to crush the lens completely using the double chop and cross chop maneuver. Again, you want to utilize mechanical fracturing forces, pulses of ultrasonic energy and vacuum. And even though you have a big lens like this, and the CDE should be significantly high in cases like this. And again, these cases tend to have weaker zonules as well. This is a very zonular friendly technique. And you saw my CDE was only 2.29 with the case with a perfectly centered lens in the bag. So again, I hope this was helpful to you, and thank you for your attention.